strike today is very, very well supported. The reason it's quiet is that ambulances are out on jobs.
Ambulance crews are out on jobs at the moment.
As they returned from hospital drop-offs, the ambulance teams joined the picket line.
I think I'm on a reasonable pay for a 22-year-old, but for the amount of responsibility that I've got, it's ridiculous. It's not enough.
In England, ambulance teams in 9 out of 10 regions were on strike today, as were teams across Wales, some 25,000 workers. In Scotland, strikes were called off after an enhanced pay offer was accepted last month. Northern Ireland ambulance workers will strike on the 26th of January. Teams in England and Wales plan to strike again 3 days before that.
We have another strike planned for the 23rd of January. That gives the government about a week and a half to try and sit down with us and resolve this.
Unison's General Secretary visiting strikers in Sheffield. In Parliament, the Labour leader accused Rishi Sunak of causing the walkouts in the ambulance service and nursing.
If the Prime Minister had negotiated with the nurses before Christmas, they wouldn't be on strike. If he'd negotiated with the ambulance workers, they wouldn't be on strike either. So why is he choosing to prolong the misery rather than end these strikes?
Prime Minister.
The honourable gentleman simply doesn't have a policy when it comes to this question. If he wants, he talks about wanting to end the strikes. The question for him is simple then. Why does he not support our minimum safety legislation? We all know why. We all know why, Mr. Speaker. It's because he's on the side of his union paymasters, not patients.
Some in the unions are hoping that an offer of a one-off payment expected imminently from the Welsh Government could be the basis for progress in England too.
The Secretary of State did talk about pay, and he acknowledged to us and to the employers that were in the room that he knows that to resolve the dispute it's going to take improving pay for this current pay year.
Near Parliament at Wellington Barracks, some of the soldiers drafted in to work on less urgent ambulance calls. Government sources said cover did seem to have worked today, although hospitals across the country were braced for a bottled-up surge of patients tomorrow.
So if it is similar to last time's strike, we know that tomorrow will be a busy day, and probably from midnight tonight when the strike ends.
In the battle for public opinion on the health service, the Prime Minister earlier decided to answer a question he had been ducking about whether he used private health.
I have used independent healthcare in the past. I'll answer her question. I am registered with NHS GP. I have used independent healthcare in the past, and I'm also grateful to the Friarage Hospital for the fantastic care they've given my family over the years.
I heard the Prime Minister saying he's now registered with an NHS doctor, so he'll soon enjoy the experience of waiting on hold every morning at 8 a.m. to get a GP appointment.
The winter of strikes was added to today when 100,000 civil servants announced a strike next month. Rail unions suggested their dispute was moving further from resolution. Tonight in South London, ambulance call centre staff joined ambulance teams on the picket line. An escalation of the strike action, they didn't join the December walkout. Government sources say their real-time monitoring of ambulance cover suggested there had been fewer calls from the public, and the limited cover offered by the unions had worked reasonably well.
Gary Gibbon. Well, joining me now is Saffron Cordray, the interim chief executive for NHS Providers, which represents NHS organisations in England. Good evening. We got a glimpse of it in Gary's piece there from the hospital in Warwick, but what is the effect of a day of ambulance strikes on the NHS?
Well, we know that any industrial action is incredibly disruptive. I think what we see when we have this strike action, particularly with ambulance services, is that actually call demand goes down. And that's because public is heeding the advice which says only call an ambulance in an emergency, but also worryingly we know that sometimes it's because people don't want to come forward for treatment because they fear huge delays or that they won't be helped. That bit really worries us. But overall, the picture that we have seen has been one of unions and staff working in partnership to make sure that patients are being kept safe. But there has been disruption. Inevitably, there's been disruption. And I think what your piece showed is that staff up and down the country and trust leaders up and down the country will be bracing themselves for the additional demand that will come tomorrow and in the following days because of the industrial action today.
And presumably there's a cumulative effect from further strike action. You know, do you get to a point where the system breaks, or perhaps it's already broken?
I think what we're at is a situation where the NHS is incredibly good at being flexible, deploying staff, taking them from many different clinical areas and putting them into the place that needs most help and support. And so on strike days, we see that happening. We've seen community services stepping into the breach and answering 111 calls. So we've seen people really pulling together. But of course, what that means is a knock-on effect. Community services staff being taken from their role and put into a different role. That means that there is a gap there. And whilst NHS services can step up to these challenges on a day-by-day basis, the knock-on effect is that business as usual doesn't happen. So that means an impact on things like the waiting list. Usual procedures won't be carried out, services won't be provided in the same way. And also there can be a little bit of a chilling effect in the run-up to this industrial action. Things don't get booked in the same way because people know it's going to be challenging. But when all said and done, I think what we have seen is a remarkable amount of continuity of service. And what we have seen is some really positive, pragmatic action from staff who are incredibly tired now.
But what do your members want now? I mean, the health unions are very clear. They're saying, forget the pay review body, we want to directly negotiate with ministers and resolve this. Do your members want the government to do that and sit down with the unions?
Absolutely. Trust leaders are really clear that they want to see this industrial action from nurses, from ambulance services resolved. And it's absolutely critical that the government and the unions both come round the table and discuss pay, terms and conditions and patient safety. And it's critical that they do that about this year's pay, because that's what this dispute is about. It's about this year and the years that follow that. And I think that we saw a chink of light over the weekend when we thought that there were going to be the start of constructive conversations, but that feels like it's dissipated a bit. What we want to be able to see is the government come round the table and talk about pay, and for the unions to come to the table and talk about pay and really get to the bottom of this so that we can then focus on getting those waiting lists down and getting the urgent and emergency care service back on track.
There are some people arguing in some parts of the media that there are too many managers and that's one of the unnecessary costs within the NHS. How do you view those arguments?
I'd absolutely dispute that. I think that what you have to remember is that the NHS is a hugely complex industry. It's a hugely complex service. A large proportion of those managers that we see in the NHS are also clinicians providing critical services. And compared to other countries across the world and across Europe, the NHS is typically undermanaged in terms of the level of management, the resource that's in place. So I absolutely dispute that.
Saffron Cordray, thank you very much indeed. Over to Cathy in Leeds.
Thanks, Krish. Well, earlier I spoke to Unison's General Secretary, Christina Machania. She visited striking paramedics at York Ambulance Station. I asked her if perhaps she was hoping that the more havoc the union created, the more likely ministers were to compromise over pay.
Well, as I say, we're not trying to cause havoc to the public and the patients. We are trying to cause, inconvenience and havoc, I suppose, at government levels. We want them to realise how serious this is, and we want them to talk to us. We've been telling them that this strike's been planned for 6 months.
If you're trying to cause political havoc, as it were, isn't that a suggestion that
your action is politically motivated?
No, our action is about trying to force the government to talk to us about improving the pay for people who work in the NHS, and this dispute primarily is about the ambulance sector staff. And it is connected to the services, because if you don't pay staff, they leave the service, you can't recruit good people in, and that just makes the situation worse.
There's a suggestion, I suppose, that this wave of strikes may be having the impact that you desire, because there's the idea floated of backdating a forthcoming pay rise or putting in a one-off payment. Would you commit to putting either of those things to your members?
Well, it would depend on what they were. At this moment in time, we've had nothing to put forward to us. The meeting on Monday was just the first indication that they were prepared to talk to us about this year's pay, not just pay in the future. And that's a good sign, and we're happy to continue with those talks. But we've got another strike planned in about 10 days. The government has got a very short window to talk to us to try and make sure that we don't have to take that strike action again.
You've said they've got a week to put something concrete on the table, about a week. How optimistic are you of that happening?
I'm trying not to be pessimistic, put it that way, rather than saying I'm being optimistic. I think it was a good move that Steve Barclay said on Monday. They will talk to us about pay for this year, but we're miles away from any sort of settlement, or even miles away from any kind of offer, as far as I can tell.
Doctors say that record ambulance waits are causing an extra 500 deaths a week, and there's analysis in the Times newspaper saying that 50,000 more people than normal died over the last 12 months. Today will inevitably add to that grim tally, won't it? Does that, in all honesty, weigh on your conscience?
If I thought that would be the outcome, then yes, it would. I'm not convinced it will be, because we're still responding to life-threatening situations. So, ambulances, people have been called off the picket line to go into ambulances. One just left a minute ago.
Do you really think that no more people will die because of your action today?
I can't give that guarantee, but I would say that it's quite likely that no more people will die. I mean, those figures you've just given about how many extra people have died, we've only had one. This is our second day of strike action in the ambulance service. They can't blame that on us. If anyone's putting the country and people at risk, putting patients' life at risk, it's this government, because they've been, dilly-dallying about whether they would talk to us, refusing to talk to us, we've given them, they've had 6 months to try and resolve this.
Do you think ministers have got blood on their hands?
I think this government has got blood in its hands, in terms of the fact that they've allowed the NHS to be so seriously run down. I mean, it's totally chaotic. If you speak to any of the people here who are on strike, they'll tell you they've never known it that bad. That's the message I get all the time from people, from our members who are paramedics, call handlers. They've never seen the service so bad.
But if you had a relative who was in desperate need of a hip operation, a knee operation, would you be sanguine about them going private right now because of the state of the NHS?
I don't know. I mean, it would depend, wouldn't it, on theoretical
You
questions.
wouldn't rule it out?
Well, you wouldn't. If you've got a member of your family who was in serious straits, then obviously not. But the fact is, most of my family don't have that kind of money to be able to go privately for a hip or a knee replacement. I mean, they just don't.
Do you back some kind of coordinated action on February the 1st, which is what's being talked about among some unions?
Well, I think there's perhaps a misunderstanding about what this means. My understanding is it's not a day of strike action, although some unions who may have been planning strikes on the 1st of February will go ahead with them. But most of the unions who aren't, I think, are still not planning to incorporate a strike on that day, but may look at doing other coordinated types of events across the country. And we'll be working with the TUC about this very closely.
And you've got a lot of public sympathy still. Some of the other unions don't. So you want to plough your own furrow?
Not necessarily. I mean, we work closely. There's GMB people here. We work with Unite. So we will work with the unions who are in the sectors where we're taking strike action. No problem with that whatsoever.
Christina Machania, thank you very much.
Thank you.
Well, in response, the Department of Health and Social Care said it's making up to £14.1 billion available for health and social care over the next 2 years, on top of record funding, and giving an extra £500 million to speed up hospital discharge. And if you want to know more about strike laws and what minimum service levels are, you can read our fact check article on our website.